Welcome back to Morning Break, and this morning we have another Brain Matter segment brought to you by Gates of Brain Health, where Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician, is joining us to talk about Parkinson's disease. So good morning, Dr. Gates.
Good morning.
I guess the first thing we have to ask you is, what is it? For those of us who are not familiar, we obviously know it's a neurological disease, and then the symptoms can be wide varying. We all kind of have a different idea as to what we think those symptoms are.
True. So Parkinson's can manifest with slowing of movement. Lots of times I think relatives are most aware of a tremor that develops, but there are other conditions that can cause tremors also.
Okay.
And then the hallmark clinical features are not only perhaps a tremor, slowing of movement. So doctors will take patients through exercise or like testing where we have them rapidly alternate opening and closing of the hand, finger tapping, things of that nature. And then there's also this appreciation of rigidity when the doctor moves the person's limbs involuntarily. Postural instability used to be part of the diagnosis, now it's not, but postural instability is something we see with a lot of patients who have Parkinson's. You may have seen someone with Parkinson's and they may be walking kind of hunched over, and that's a cardinal feature of the condition as well.
And does Parkinson's affect men and women?
It does, yeah.
Yeah? Okay, because I think a lot of the times instinctively we think of men having Parkinson's, but it is something that can affect women too. And
absolutely.
I guess, does the causes vary based on men and women, or is it kind of all the same?
That's a great question. So there's no one cause of Parkinson's. Some conditions are more genetic than others.
Okay.
There can be genetic forms of Parkinson's, but Parkinson's is considered largely an environmental condition, or there's a lot of question literature still about it being due to an infectious organism.
Interesting.
Because the neuropathology of the condition, where there's this protein called alpha-synuclein, it will misfold, and oftentimes that misfolding actually starts in the gut years to decades beforehand.
Wow.
And then that spreads up the plexus of nerves in your gut up into the brainstem until it gets to the top of the brainstem where dopamine is produced. And once 80% approximately of the dopamine producing neurons are lost there, then we get symptoms of Parkinson's. But the point of that is that if you take the alpha-synuclein out and you put it in like a healthy nerve cell, it will actually spread to other healthy nerve cells. So there's a spreading infectious kind of component to it, though that's not completely you know, appreciated by everyone, is the causation.
So we've got these two causes, right? Sometimes it might be caused by this infection possibly, or environmental factors. What do you mean by that?
Environmental factors, so there's something called the Rust Belt. And so they see that in areas of, for example, America, where there were a lot of toxic chemicals, there's a higher incidence of Parkinson's. We know that certain pesticides can predispose someone to Parkinson's. A big one are perchloroethylene and trichloroethylene. These are chemicals oftentimes used in dry cleaning, but they are high in other industrial solvents and rubbers and things like that. So that is important as well to look at in the history of someone who has Parkinson's.
Okay, and so genetically though, because a lot of people, when we have these conversations, they want to know like if they might have a predisposition for it that's been passed down. Is that also common?
It is a component of it, but it's not like the entirety of the condition. Whereas like Alzheimer's has a much stronger genetic predilection, but it's not always genetic either.
Okay, so then now that we know what may cause it, if somebody goes to see their doctors, they get this diagnosis, is it a death sentence?
I wouldn't phrase it that way. There are many therapies now for Parkinson's patients. There are many medication therapies. Renown has a movement disorder specialist who focuses on conditions like Parkinson's, who's a neurologist. So there are many options. The Parkinson's Support Society of Reno Nevada, forgive me, Dr. Lakshin, if I didn't get that name correctly, but Dr. Lakshin, you've had her on the show, and she's wonderful. She puts together a lot of resources for Parkinson's patients. The Rock City Boxing, she brings in other holistic practitioners, medical practitioners. There are deep brain surgeries for Parkinson's patients now. So there are many more options, but there's no cure, so to speak,
so
for
in
everyone.
in a way, it's really just, you know, kind of like it's working with the limitations that Parkinson's is now set, and maybe having to almost like relearn how to do certain things, or maybe accepting the challenges that Parkinson's going to be there, but working through them, and there's lots of resources to do
There's
that.
lots of resources, and then that's where Gates Brain Health comes in. We holistically support Parkinson's patients as well. Ton of research on how the gut, because that's where the condition starts, may affect the inflammation of the condition. the whole medication route of Parkinson's treatment actually started with something called the velvet bean. And the velvet bean it grows naturally in the tropics.
Okay.
And researchers noticed that those who had Parkinson's symptoms, they would chew on this velvet bean kind of intuitively, and they knew that it helped with their Parkinson's symptoms. So there's a whole holistic support strategy for Parkinson's patients. So if somebody's early, they don't necessarily want to take medications or looking for alternative options,
Right.
that's something that we can talk to them about. But as always, you know, I really try to support everyone in this. For those who want a
Right.
medical frame of reference, neurologist has a great movement disorder neurologist as well.
Yeah, and like what we always learn when you come on the show is that there are lots of avenues to these diseases, and that is
True.
where, you know, gut and brain health all come in together in alignment.
so,
So thank
yeah.
you so much, Dr. Gates,
Thank
for
you,
being
Katie.
here. We
Yeah.
appreciate it, and thank you guys for watching. We'll be right back after this quick break.